Hello and welcome to Dental Notebook. In today's topic, we're going to read about the permanent dentition period. So this is going to be our final topic on development of dentition and occlusion. So here we will see that how does the permanent dentition period occur. So the formation of permanent dentition period occur after the birth. Okay, except for the first permanent molar. Why? Because the first permanent molar formations occur before birth along with your deciduous dentitions. So all the teeth except the first molar, the formation of the permanent dentitions occurs soon after the birth. Now there is a characteristics features of the permanent dentitions. It's that the permanent incisors tends to erupt more labially as compared to your deciduous incisors. Why? Because they are more longer and they are more wider. So because it requires more space, so to acquire more space, the permanent incisors erupts more labially as compared to your deciduous incisors. So the permanent dentitions erupts in a sequence. So let's study the eruption sequence of the permanent dentitions. First, coming to the maxilla. So in the maxilla, the eruption sequence is something like 6, 1, 2, 4, 5, 3 and 7. For the mandible, it is 6, 1, 2, 3, 4, 5, 7. Alright. So in maxilla, first there is the eruption of the first permanent molar. Then your central incisors, lateral incisors, first premolar, second premolar, then your canine and then your second molar take place. For the mandible, it is your first molar, central incisors, lateral incisors, canine, first premolar, second premolar, and your second molar take place. Now, it would be very difficult for us to remember how the chronology of the permanent dentitions occur. So, to make it easy, we will learn it by making some blocks here. So, we are beginning from the last row. First, you have to make 2 straight blocks here for this teeth. Then you have to make 1 L block here. And then you have to make 1 diagonal block here. And then again you have to make 1 opposite L block here. And the rest of the 2 block will have single block each. Okay. Now let's see the age group by which it develops. So this one would be your 6th year. Okay, add just 1 year after it. This would be 7th year. This one is going to be your 8th year. This one will be your 9th year. This one is going to be your 10 years. This is your 11 years. And this is going to be your 12 years. Okay, so the wide range would be from 6 to 7 years, from 7 to 8 years, okay, from 8 to 9 years, from 9 to 10 years, from 10 to 11 years, from 11 to 12 years, and from 12 to 13 years. These are going to be the ranges of each teeth here. So by this you can make a clear-cut vision that on which year which teeth develops. So let's see the chronology. That is from 6 to 7 year of the age, your first molar of both maxilla and mandible develop, and the central incisors of your mandible develop. From 7 to 8 year of the age, your maxillary central incisor and mandibular lateral incisors develop. From 8 to 9 year of age, your lateral incisor of the maxilla develop. From 9 to 10 year of your age, you can see that your mandibular canine develops. Okay, then from 10 to 11 year of your age, you can see that the first premolar of the mandible and the first premolar of the maxilla along with the second premolar of the maxilla develops. Okay, from 11 to 12 year of age, you can see that the second premolar of the mandible and the canine of the maxilla develop from 11 to 12 year of age. And from 12 to 13 year of the age, you can see that both of your mandible and maxilla second molars formations take place. Now, due to the evolutions of human, we have seen that most of the time the third molar, which is 8, generally is absent or it is embedded inside the bone. But in most of the person, it comes out in the age group between 17 to 21 years. Okay, so this is your eruption sequence of the permanent dentitions. I hope it is clear to you all. Thank you for watching the video.